necessary supplies, identify the client using 2 patient identifiers, explain the procedures to the patient, provide patient privacy, and wash hands. Position the patient in semi-Fowler's position, place the towel across the chest of the patient. Prepare a waterproof trash bag and position it so that you will not need to reach across the trach site or sterile field.
Now I'm going like this.
Wash hands. Don't clean gloves.
When I went last time, this one sucks. And then I'm going to have to pull it all the way over here. So I'm going to have to do it again right here.
Just so that we're not trying to say your
And then remove the stoma dressing and discard it in the trash bag.
Once you clean it, dip the cannula.
You're going to assess the site for color, drainage, and edema. Remove gloves and wash hands. Open the trach care kit.
Yeah.
Should we start over?
I missed this one.
Do you want to?
Because we're not gonna have time.
Lift out the
You have this one?
inner sterile field.
This is where we're just ad-libbing, basically.
Yes.
Take
Take out the inner container. Try not to contaminate the other items. Dump it. Oh, you're gonna keep that. You keep it right there because you need 3.
Now, Boo Boo, you know we're recording you, right?
And pour a small amount of sterile saline into all your sterile solution containers. Don't sterile gloves.
We're gonna pretend like this thing.
That would be on top. Yeah.
Yes, it will. Yes, it will.
Take this off. How did she say? She said we should do it sideways.
Let me zoom in on that real quick.
And we would pretend that she did it right when she put on a sterile glove.
I did. I do it. Start at the thing and turn. Okay. Locked. Good.
Oh my god.
Using your sterile hand, moisten the gauze.
With your non-dominant hand, remove any oxygen device.
This is already
Unlock the inner cannula using rotate clockwise and remove the inner cannula.
To unlock it's clockwise?
Yeah.
Okay.
So you rotate it. Oh, it's like a little. Yeah, that thing right
Yes,
there.
I don't want it.
It's very
like,
thin.
Once I take this tube out,
Not coming
and
out.
we're putting it in here, and it's like I'm crossing
Like
my
those gloves
sterile
are too big
field,
for you.
so I have to
They
put it
are.
in here, right?
Well, I don't think that you're
Grab a pair of clean gloves just to keep it in there for you.
Try just pulling it with this.
You're gonna take care of it all. But remember, that person is either not with it, they're because think about it. You can't really unless you're
Replace oxygenated device in the trach. Continue to hold the cannula by the top. Work quickly. Use your dominant hand to scrub the inside and outside of the cannula with the wire brush.
just go ahead.
If unable to remove secretions from the brush, use a sterile pipe cleaner. Dip the cannula into the container of solution, agitate for about 10 seconds.
So I can
Fit rinse it. Inspect the cannula for cleanliness. If clean, tap the cannula with the inner edge of the solution container to remove excess liquid.
bring it all the way around.
Reinsert the inner cannula into the trach tube and lock it in place.
We wasn't supposed to dip in a third one. What's the third one for?
So this one is, you first dip it in there. Yep, you're gonna dip it in there, then do the scrub, and then rinse it in here, and then you put that back. The third one is gonna be for the sponges.
Oh, okay.
You did this.
Thank you.
Yeah, because this is dirty.
Now rinse this little clean one.
Reinsert into the trach tube and lock it in place.
And now we can put it back.
Real quick, when we first open it up, and like all this is in here.
This is not going in.
And your sterile gloves are right here. And if you like dump it like this, your sterile gloves end up on the bottom.
Gently pull on the inner cannula, ensure it is locked. Reattach any oxygenated device.
Okay.
Using your sterile hand, moisten a sterile gauze pad in the third solution container
Not that one.
squeeze out excess moisture.
You're supposed to use them.
Wipe the patient's neck under the trach tube, phalanges, and ties around the stoma.
Throw it away. Get a new one.
Yep, start at 12 o'clock to 3 o'clock.
Dump it. Get a
12
new
o'clock to 9, 3 to 6, 9 to 6.
Dump it. Get a new one.
That's it, and now I have to do the Q-tips again.
Then you'll dry the site with a dry gauze pad.
It'll be the first thing that's Yeah.
Okay, now what do I do? Not one. Okay, so sterile gauze. I'll get moisten this one because it's my last
Done.
Apply a split drain dressing.
Okay.
At this point, is it clean?
At this point,
Yeah.
Where though? Like, what am I doing this?
What am I
Just have to wipe it under
This
this.
is my sterile hand.
Assure physicians. Okay.
Because I had it on there. Wipe the decision
You would assure physicians' orders to change ties after a fresh tracheostomy. Often ties are not changed for 3 to 4 days. After initially healing, ties are changed daily as needed. Thread one end of the tie through a flame from the underside. Pull a tape halfway through and pass the two ends around the back of the patient's neck.
I don't know if you
Garbage.
now you
So you would start from under,
so then
Wait here.
behind it. You would start from
And then I take
behind,
this and get them
like
wet.
behind.
Like from the
And I'm
like this
like,
way.
Why do I do the 12 and 2? Are we talking about at the rope or are we talking about here?
From the top to the right.
yes.
From the top to the right, from the top to the left, and from the,
So grab those two and put it behind the
I
face.
don't want to try from
from 3 to 9.
Insert one end of the tie through the flange. Pull a tight taut around the flange opening and tie a square knot below the rim.
new Q-tip.
Be sure you can place one finger under the tie to ensure it is secure but not too tight.
Okay, and then I gotta save one for drying.
Dry it afterwards.
So now
I'm really tired
I'm just
of
doing
this.
strictly
You want
around
me
the
to
neck.
try
We're doing nothing with this.
You would end up putting a knot in, but have enough room for one finger. Because you don't want it too tight, but you don't want it too loose.
It's good, man.
You will have to
There you go.
clean that. It's gonna get all bumpy.
And once that's
So
good,
are we
then
only-
that's pretty
can we
much
only
it.
do
I
one
want to
wipe
ask
with
her,
this,
what do
with
you
these
think about
gauze?
asking
Is
her
it
about this
Which
section?
part?
one away?
Changing the
We can't do
securing
the
device
whole
or
like
press
flip.
tube.
Yeah, I would ask because I don't know if we're doing
I don't
that.
know what they mean.
Yeah.
Give him his oxygen back. All right, done. And then let's dry. Dry.
Professor,
Like,
I have a question. Okay, so 14. Obtain assistance from the healthcare worker. Changing securing device requires 2 people. What is that referring to?
That's when you're changing your ties. Okay.
Oh, because it went through changing ties first, and then
Yeah.
it said we need 2 people after changing the ties.
Yeah.
Right.
So
Yeah.
It's contradictory.
You if you don't take that first tie off
Stupid neckties.
before you do your second tie, you essentially don't need anyone there, right?
Okay.
Okay. But if because